Good afternoon, it's Tuesday, it's 2 o'clock. Welcome to Foundations Live. So, afternoon, everybody. Sorry about my slightly glitchy camera today. Fortunately, I won't be talking very much, so you won't have to see it very much. But thank you for joining us this Tuesday afternoon. I'm Paul Smith from Foundations, and really pleased to be joined by two doctors this afternoon. So we're going to be hearing from Dr Cate Pemble, who's going to be talking about the DESH project from the University of Stirling, and our own Rachel Russell, who's going to be talking about behaviours of concern. So Kate and Rachel will be joining us a little bit later.
Foundations Live.
So just a couple of bits of business before we get into the meat of today's presentations. We're going to be, I'm find the right bit. We're going, well, we already are the National Body for Home Improvement Agencies and the Disabled Facilities Grants. So if you need anything, any help with anything DFG or HIA related, please do get in touch with us, because we're funded by the Department of Levelling Up Housing and Communities, as they were until last week, or now they've reverted to the Ministry of Housing, Communities and Local Government. But I haven't got the new logo yet, so still says DLUC, but it is now the Ministry of Housing, Communities and Local Government again. And closed captions are available on social media if you need those, so particularly on LinkedIn and on YouTube. I don't think the feed on Twitter is working today, but if you do need closed captions, they're definitely on LinkedIn and YouTube. So just a couple of other bits of business before we get cracking with the day. The DFG Champions Roadshows are back in the autumn. We'll be visiting Liverpool, Sheffield, Wolverhampton, London, Colchester for the first time, and Southampton. Tickets are now available. Stan put the link into the chat. So if you want to book and come and join the DFG Champions Roadshow, well, we'll be talking about adaptations in social housing. We'll be talking about contractors and be launching a new initiative around contractors. And we'll also have a session on behaviours of concern. So some of the stuff you'll hear about from Rachel today. So free tickets are now available. They've already been launched to members of our DFG Champions Facebook group. And some of them, particularly Wolverhampton, are almost gone. So if you do want to come, please click on the link and book. It's still free to attend. You still get lunch. We still have a quiz and prizes, and we have a good day. So it'd be good to see you in one of those cities. So I say we're visiting Liverpool, Sheffield, Wolverhampton, Colchester, London, and Southampton. Right, that's the business bit out of the way. So now we will start the show.
Foundations Live.
So very pleased to welcome Cate Pemble, who I saw at it was the Arcot Housing conference probably a couple of months ago in deepest darkest Coventry.
It was indeed. The weather was lovely though, so
it was.
That's where the summer went.
I think so. It was a couple of days of sunshine in Coventry, where Kate did a kind of presentation that went down very well with the House Goatees. So we asked her to come and talk to you about it as well. So I'll put your slides up, Kate, and hand over to you.
Beautiful. Thank you so much. So yeah, my name is Dr. As I've been reminded today, Dr. Cate Pemble. I work at the University of Stirling, and today I'm presenting on a raft of work done by the Designing Homes for Healthy Cognitive Aging, or DesHCA project. Now, let me see if I can successfully flip slides first time. I can. When I say that it's a raft of research, this is not even all of the team. It's a huge effort across 3 years. We ran from 2021 up until 2024. And what our goal was essentially to look at the different ways that housing design and adaptation could support people to remain in the homes and communities of their choosing for longer. We were funded by the UKRI's Healthy Ageing Challenge. So one of a big suite tackling big questions and looking at how people can age better in the UK. Now, what does that look like in practice? Good ask. That's pretty much what we're going to talk about for the next half hour. Now, apologies for anyone who knows these statistics already, but just to go do a little bit of a run through. If the question is, why should we be focusing on housing for healthy cognitive aging? Let's do some quick statistics. I promise not too many numbers in this presentation. The UK population aged over 65 in 2018 was estimated to be 18%. So that's just under 1 in 5, which is pretty substantial. However, it's important to know that as we go towards 2050, we're looking at closer to 1 in 4 people being over the age of 65 and a significant proportion actually being over 85. I did at one point do the numbers and the math on where your birthday had to lie in order to push you over into the yellow, but I upset myself, so I will not be relaying those to you today. Important to know, though, that this is what we're working towards. This is where we're going. And of these almost 1 in 4, 1 in 3 will have a significant healthcare a condition requiring significant amount of healthcare by the time they're 70. So we have a population where almost 1 in 4 is over 65, where a significant portion of those have healthcare conditions that significantly impede them in one way or the other for the rest of their lives. Now, the other part of this that's important to take into fact is that an estimated 85% of adults would prefer to stay in the homes of their choosing as they age. However, only 10% of houses in the UK are adapted or equipped to support people as they get older, as they do begin to collect these different diagnoses, these different health conditions, and these different frailties. 85%, 10%. Now, I'm a qualitative scientist, I work in words, but I can tell the difference between those two numbers. So if 85% of people would choose to remain at home, even if they get a diagnosis of dementia, and fewer than 10% of homes have the accessibility features to support anybody, let alone somebody living with dementia or any other kind of cognitive impairment, that's already a bit of an issue. We're going to talk today about some other statistics. We know that from our research, it looks like about 90% of adaptations are in the bathroom alone, over that, in fact, and that people who are living with dementia or their carers are 3 times more likely to say that they've received an adaptation that focuses on mobility rather than anything that supports their cognitive health. Now, that might be appropriate if you happen to have dementia and something that affects your mobility, or your mobility is affected by your dementia, but it certainly doesn't deal with all of the cognitive aspects that you're potentially needing support with. And that's where DesHCA comes in. From an academic perspective, there are a raft of issues that we knew going into this project. From the literature, we knew that while there were good pieces of research about accessibility, about adaptation, they usually had issues of scale. They usually focused down on 1 or 2, maybe up to 10 key houses that were used really as a pilot. And then there wasn't a huge amount of discussion or consideration of what it would mean to take that up to scale, which is obviously an issue if we're heading into a future where 1 in 4 people is over the age of 65 living with a healthcare condition. There were issues around cost effectiveness and what that meant, and cost effective critically for who and for what. A lot of the outcomes and measures of success that we used in other pieces of research were really defined by the researchers themselves, which can lead to a very slanted view of what something looks like when it's working, or alternatively when it's not working. There were many barriers and facilitators to implementation, but those tended to be really local because of the scale. And while there were examples of promising practice, especially when adaptations and changes to the home were made early, there were a lot of local factors and inequalities that could factor into that. The postcode lottery seems to pervade throughout the research, which is not particularly surprising. Now, who holds the key to this question? It could be that older people themselves hold the key. This is fairly radical, the idea of asking people what they actually want as they get older. It could be that building professionals hold the key. They're the ones, after all, creating and adapting our housing stock, or housing management, given that they are managing a good amount of the stock in the UK. It might be that health and social care holds the key. After all, we are talking about adapting for health conditions predominantly. Or it might be that policymakers are the ones who we really need to be targeting. It would be very simple and very lovely if the answers lay with just one of this group, but they don't. Spoilers, I suppose. Now, if things could move forward, how did we get this data? DesHCA did a huge amount of research over those 3 years, and this is just a bit of a taster of them. We did secondary data analysis, which means pulling in big data sets that already existed, gave us an insight into the lives of, roughly speaking, about 30,000 people or so. We did what we called a home audit, where we took the Dementia Services Development Centre's latest dementia design guidance, crunched it down into essentially an online platform that people could use themselves, and then encouraged them to go through and mark their own home on this basis. It gave us, as far as we can tell, one of the only pieces of research that identifies how dementia-friendly homes in the UK really are, as opposed to how we would like them to be or how we would hope them to be in the future. We did what's called an eDelphi panel, which is a consensus exercise where we get people together and try and really dig in and understand where the points of contention are when we start to talk about what inclusive design and age-inclusive design really looks like and what people really want. We did a creative mapping exercise with 63 older families where we went directly to older people themselves and asked them to tell us about the house they lived in now, the houses they've lived in the past, and the houses they hope to live in the future, and what was important to them. We did passive sensing in 13 more households. This is where we attached a range of fairly high-tech sensors to the house to monitor things like air quality, heat, and light. So we were essentially interviewing the house, much in the same way that we interviewed the people. We did professional interviews with 21 people working in the building and construction industry to help understand things from that very business-focused perspective. And we ran 94 people through our VR workshops. And that is where we put our designs really into the hands, or perhaps the eyes, of people themselves, both older people and professionals in various roles, and asked them, what do you think? What do you like? What do you not like? What needs to change? And that design went through 4 iterations by the end. We had feedback workshops on those, and then we turned the entire thing into a serious game, which is, funnily enough, a game you play for serious reasons, leading to about 30,000 people, 30,813, if my math is correct, involved in the project over the course of those 3 years. So that's a fair amount of data to be pulling from. Now, what did we learn from all of this, and what do you need to know? 1, adaptations are clustered. Our quantitative folks did a good amount of research and analysis on existing data sets, including the English longitudinal study of aging and the Scottish Household Survey. And they came out and said, you know, about 56% of households are reporting that they have some kind of adaptation. We had a look at that data and we chunked it down and decided that the reasonable way to look at these was to say that they were categories, 3 of them. 1 being property-based, i.e. the adaptations that you install in the property and then become, for all intents and purposes, somewhat invisible. You don't think about using them anymore. Once you've installed a widened doorway, for example, you don't go through that doorway every time and go, oh, isn't this a lovely wide doorway? Or perhaps you do, but only if you're not bashing your fingers anymore. Movement-based adaptations tended to be the ones that people were actively engaging with in order to get around. So that's your stair lifts, that's your handrails, anything that people were actively interacting with to get about their home. And then bathroom adaptations, which were, funnily enough, adaptations in the bathroom. And those actually took up 93% of all adaptations that were being reported. 93% of adaptations put in the bathroom. And then obviously there's that statistic again. Someone living with dementia 3 times more likely to get an adaptation that supports their physical function. And from what we've just discussed, probably their physical function specifically around bathing and toileting, something to do with the bathroom rather than any other part of their life. We had a look at the data spread that we got back from asking people to assess their own homes, and we found statistics that actually really surprised us. We had kind of assumed gently that age would be a fairly good predictor of moving into an accessible home. It's a very bad predictor of moving into an accessible home. In fact, on the left-hand side, don't judge me, my rights and my lefts are difficult, you can see that while people's health conditions do go up as they age, which tracks with everything else that we know, They do not, in fact, move into more accessible housing. That's your hex plot on the right-hand side. And for those of you not graphically inclined, I will add a little line here. That is a straight line pretty much across the data set in terms of age, people not moving into more adaptive homes and more supportive homes. So clearly we were wrong on that one, which opens a number of questions, certainly from our perspective. What we knew from that eDelphi, that consensus exercise, was that people had a fairly strong idea of what age-inclusive home design should be. It should be modern. It should be beautiful, something that people were really proud to say that they lived in. It should have features that supported people living with physical, cognitive, and sensory impairment, because as you get older, all of those things become more likely. It should be easy to heat and to cool. Remember, we were doing this research in the middle of both the back end of COVID and the cost of living crisis, so issues around affordability and particularly heat were really at the forefront of people's minds. It should be able to adapt to changing lifestyles, and that's not just in terms of people's needs, but people's lifetime. A house that you move into in your 30s should be able to accommodate you being there in your 30s and perhaps with a young family, but equally able to support you when that family move out or adapt to your changing needs as you moved into your 70s and 80s. That is what an ideal age-inclusive home design would look like. It should be within walking distance of a vibrant intergenerational community. People didn't want to be siloed and stuck out on the outskirts. They wanted to be in a place that made them connected to their community and allowed them to keep doing crazy things like accessing food and getting a takeaway, both of which in the data. There was, however, less consensus around the kind of activities that should be supported if you live in an age-inclusive home. Now, I'm not going to ask anyone to read a lot of this very small text, but take it from me, we put together essentially a list of activities that thank you so much, that was very neat, that other people suggested. We asked people, what kind of activities would you like to see be easier? And then for this graph, we went back to them and said, okay, give us your top 10. What are the top 10 most important things? And the results really surprised us. You're going to hear this a lot. It's okay. For one thing, while things like staying independent and being physically active come really, really high, and that makes a lot of sense, the quick readers among you will notice that going to the toilet is halfway down, and having a bath and getting dressed are even lower than that. Those were activities that we thought people would be really intense about because it's all about your independence. They weren't. So we went back to them and said, we think that you've been categorizing these. We think if you've chosen staying independent, in your head, that means that you perhaps are also able to go to the toilet and get dressed and have a bath and do all of these things independently. Maybe that's about being physically active, or maybe it's about doing activities you enjoy. Could you take these activities and drop them into categories for us? Which makes a lot of sense if we're going to be talking about how we adapt your home to help you do these things. What we discovered was people do not always talk about things in the same way. And I think this will resonate for a lot of particularly occupational therapists and people in the field. So when we asked people to go ahead and chunk down these activities so that when we said this house and this housing design will support you to do X, stay more independent, stay more active, we would all know what we're talking about. And while in some cases, it's very clear what the answer is. For example, listening to music, 90%, that is an enjoyed activity. Exercising, definitely a physical activity, 90% happy with that. When you get down into some of the other things, when you start talking about doing the laundry, is it about physical activity or staying independent, or having a bath, or preparing food? How do we categorize that? When we're talking about how we support you, what adaptations should do to help you stay in home, what is it that we're talking about? Are we talking about support you to do an activity that you like, or are we talking about maintaining your independence or your physical activity? What is it? It brought up some real meaningful questions for us about how we listened to the people that we needed to talk to. I apologize in advance for this graph. It is tricky, but we'll walk through it and it's okay, because here is the other thing that we found in that piece of research. Looking at the mess of color over here, the adaptations that we tend to make predominantly focus on mobility. Those are your red diamonds at the top of the layer. We do actually do a fair amount of changing our environment to suit our sensory needs. However, the thing I really need you to focus on are the purple circles. Now, the vast majority of those purple circles are actually coming in underneath that 0 line, meaning that when we make a change to a home, because these are the adaptation scores, they are making our homes often less accessible to us cognitively, even as they perhaps make them more accessible physically. And that's a key issue that we start to talk about, because if we're talking about healthy cognitive aging, we're not just talking about aging cognitively, we're talking about you in your body with your mind aging as one whole person through the rest of your life. And if your home is getting progressively less accessible for you cognitively, that's obviously going to throw up issues, even if you don't end up with something like dementia. So how did we get more detail? Apologies. How did we get more details on this? First off, we spoke to older people themselves. We conducted 61 interviews with people over the age of 55. Apologies to everyone who's just offended because I said older people were over the age of 55. You are not alone, rest assured. And we walked them through what's called a creative mapping activity. So essentially, they sat down with us, and for about an hour, they talked about the home, and we mapped it out physically with them. Some people chose to do these in online programs. Most people chose to do it with pen and paper. I got in a lot of trouble for not bringing enough rulers. It was a good time. But the nice part about that is that process of mapping it out and really drawing your environment helps bring back to the top of your head the things that you do and see every day that are not important. They're the tiny little trip that you make on the stair every morning. It's the coffee table that you bang your hip on, but you don't notice because it happens all the time and it's a split second and it's gone. This kind of creative mapping really brings that to the forefront. And it brought up a huge number of themes for us, which we'll not go through today because boring you is not on the docket. However, we will talk about a couple. One of the most important things that came up, for example, was the aesthetics of adaptation. Now, the lady here in 28 is talking about making adaptations for her mother. She says that they had got wrought iron handrails on the conservatory steps, on the utility steps, and on the garage, because she might as well get it on all three, which seems fair. It looks nice. They are wrought iron, big and ornate rather than what she calls handicap steps. Now, I ask her, are you not feeling the white PVC? And she says, my mum's 89 now, so this was when she was 79, and she didn't think she was old, and she didn't want to look like she was old, and she didn't want it to look like a council house. No offense to anyone from a council house, but she didn't want it to look like I'm an old person and this is all that's available. She wanted it to look nice because there's pride in what you have. Whoever you are, there's pride in what you have. And this came up again and again and again in the data. Issues around, for example, where handles were placed. So P34 talking here about the handles are not placed in a place that's good even for an able-bodied person. She doesn't like where they are. And she asked specifically at the time, can you not give me wood? Does it have to be white PVC? Can you not give me wood? And was told no. But if you go away and you get them yourself, we will come back and fit them for you. And then life happened. They've been in that home for years and they've never gone through the process of getting those handles refitted. Why does it matter? Our 128th participant did really well in highlighting for us. Why do aesthetics matter? Because this is not just a home for living in. This, for some people, is the home that they prefer to die in. So she's saying here, my favorite room is the lounge, definitely, because I have views, I have big windows. I have windows, big windows from floor to ceiling, and it's a beautiful room. I love it to bits. I want to die sitting on my favorite chair in the bay window looking out to sea. That's my ambition. This is my dying position. That's how I want to die, sitting in there. And I want everybody to have a party in that room afterwards. This is a home that has a life element that we love, that the social part is important. We have to have room for people to be here. And what does that mean for how we adapt it as we age? These issues around living at home came up over and over again. So 15 here talking about how important it is for her that she can get the family together for a meal, even though they only live 400 yards away. She still needs space within her home that works for hosting. And that came up a lot. We made the mistake of asking person 83 if a particular room was her hobby room. And she says, yes, but it's not a hobby. I'm a serious artist and it's my job. It's my career. It's my identity. So we need a space that works for that. And then in the last part, it's a collaborative effort often. A lot of people are aging not just in a house all on their own or in an apartment all on their own, but they're aging with others. So how we negotiate our shared tasks, how we maintain our shared home is a big, big issue. We also interviewed professionals, and a fair few of them, and they talked to us about some of the issues that they saw on their side, issues around staff knowledge, recruitment, retention, opportunities to hear back from users once they've moved into the designs that they created so that they could find out what really worked for people and what didn't. There was a lack of skilled tradesmen to build age-inclusive designs, even if you could get the budget to do so, and that budget itself and the timescale were often an issue. There was a need to adapt to moving policies, issues around net zero and carbon neutrality and modern manufacturing methods and all of the other things that the construction industry are dealing with, layered in with our issues around an aging population. So, why can't we do it? What's holding us back? Big questions. First off is a stigmatized and limited understanding of what age-inclusive design is and who can benefit from it. It's the people over there. I'm not old yet. Mum doesn't think she's old yet. She's 80, but she's not old yet. It's for that person over there who really needs it. There's a tendency to design and create homes for others that we would not wish for ourselves. The idea that white PVC should be good enough. Would I want it in my house? Absolutely not. It's heinous. And I've spent however long I've spent, 50 years, making my house just the way I like it. But if you need an adaptation, you should be happy enough with PVC, right? And a lack of awareness of what age-inclusive design is and how it can be included in a variety of homes. Even people we were working with and having contact with quite frequently thought that we were asking them to invest more in a very specific subset of home design. We're not. Our ask is much bigger than that because age-inclusive design is age-inclusive for everybody. So some takeaways for you to think about. What's the difference between home adaptation and home improvement? This was one of the biggest things we ran into when we were interviewing people about their own homes. We would go through the consent process, make sure people knew why we were there and they were happy to take part and they'd signed everything. And then for some of them, our first question was, okay, so just to kick off, break the ice, can you tell me about some of the adaptations you've made to your home? And more than once, the answer was, I've not made any. Bit of a dead silence after that one. Not a good opening gambit in an interview that's going to last an hour. So we recalibrated, stopped asking that question. What we asked was, what did this house look like when you moved in? What's changed? And when I tell you the range of adaptations we found, absolutely phenomenal. But they don't count as adaptations. You see, yes, I had my entire back lawn ripped out and replaced with AstroTurf because I can't mow it anymore, but that's not an adaptation, that's an improvement. Yes, I went to the garden centre and got raised beds instead of getting down on my knees because I can't get down on my knees anymore, but that's not an adaptation. Yes, no, I had all of my carpets replaced with a wood floor, but that's not an adaptation. I did it on my own. Adaptations were medical. They were the thing that the social work said that you had to have, or the thing that came in because otherwise so-and-so wouldn't be released from hospital. There was a mental block between what people considered home adaptation and what they considered home improvement. And if people are given time and capacity and the ability to think about what they want and what it should look like for them, a lot of the adaptations we make can usually cross that line into home improvement. If you're refitting your kitchen, why wouldn't you make it more accessible? Why wouldn't you have the pull-out drawers? You might as well. Aren't they nice? It's a huge difference in mindset and looking at it. But what are we really talking about? What does it really look like? Key ideas, contrast. So while I'm sure the house on the left here is beautiful and lovely, it surely is. I can't imagine the dust, but that's not my problem. It does have an issue if you are ever going to have any kind of cognitive or physical impairment, which might change the way that you see the world. Now, if you are sensory, dealing with visual loss, a little bit of a blur here, a little bit of lowered saturation, and suddenly those pretty white doors set in a pretty white wall are completely invisible. Add on to that any kind of cognitive impairment at all, and suddenly you're stuck in a room that you don't necessarily know your way out of, and that's an incredibly distressing place to be. We encourage people to think about cognition in design. Again, this beautiful white kitchen, I'm sure lovely, but I certainly couldn't tell you how to open any of these cupboards. Are they the ones with the little rim underneath? Are they the push to pull? Which ones of them are cupboards and which ones of them are the fake in place build stuff? I really don't know. And neither would someone living with any kind of cognitive impairment, or indeed without a cognitive impairment, but with a really nasty UTI. So we suggest crazy things like handles, so people know how to open cupboards, clear fronted cupboards, so that you're no longer relying on your memory to work out where the glass is because you're thirsty. Things out on the countertop, so that if I do decide that I'm thirsty or so-and-so's come over, I can see where my cups, my tea, my teaspoons, all of that kind of stuff is, so that I can easily use it and access it. I'm no longer relying necessarily on the systems that are failing me or the systems that are having issues, because my environment is doing that work for me. We encourage people to think about access. Level access showers and wet rooms are becoming increasingly accessible and increasingly beautiful, and that's a wonderful thing. But again, issues around contrast come in. Huge numbers of older men will end up in care, in part due to issues with continence. And that, for some of them, could be dealt with helpfully by adding a contrasting toilet seat, making it very clear that this is where the bathroom is, and not making you try to find a white toilet against a white floor with a white toilet seat at 2 a.m. You can see where some of the issues come in. The important part of it, all of it, is to encourage people and support people to think about these adaptations their way. If you're thinking about it ahead of time, you have a lot more freedom to think about, well, if I'm redoing my bathroom anyway, why couldn't it be a wet room? If I'm redoing my kitchen anyway, why couldn't it be that? If I'm going to replace my suite anyway, what is it that makes a suite particularly supportive for someone who's getting a bit older? How tall does it have to be? What does the back have to look like? If I'm buying new dining room chairs, what does that look like? As opposed to it being an adaptation that comes in and I don't have as much control. Supporting people to make these choices is a big part of moving forwards to an age-inclusive future. So we need to move forward from this stigmatized understanding of what inclusive design is and who would benefit from it, to, I might as well have it. It's pretty handy, actually. Moving from designing homes that we wouldn't want to live in to, oh, I'm sorry, I could have a rainbow colored wet room. That's an option for me. Live your best life, friend. It's not for me, but you know, go out. And moving from a lack of awareness to understanding that there are options, understanding that not all of those options need to be put in place at the same time, and understanding that you can get support, you can talk to people, and that people will understand what it is that you're asking for. So really raising that awareness in all quarters, fixing the world, essentially. Now, what can we do? While the project itself has ended, the DesHCA website is still up and running, and it will be until 2029. So on the DesHCA website, which is www.deshca.co.uk, you can find not only the resources we created, including an easy booklet talking about hints and tips for adaptive home design, but our walkthrough visual design and a bunch of other things, hopefully, which will be useful to you. If there's anything else that would be handy, do please let us know. There's always the possibility for us making something later down the line. And in the meantime, thank you very, very much for listening. Cheers.
Thank you, Kate. That was kind of really. I think it's a really interesting study to get that kind of perspective. I mean, I think there's kind of lots of things in there that might kind of go against what's kind of perceived as the kind of typical understanding. I mean, kind of the very few people who actually want a bath was quite surprising when you kind of think of Britain as a nation of bathers. How few people actually wanted to retain a bath, I think would probably surprise most people.
Baths came very low, which was interesting because we'd heard from several quarters that people do not necessarily think about taking a bath, but if you try to take the bath away, that's a huge issue. Taking the bath away is a no-go.
So people kind of like it there just in case, kind of for an annual soak or something. But
I think a lot of it was very much, you know, just in case. But what if I do need it? What if I do trip? What if I do fall? But also about what removing the bath sometimes means, especially if you're being told that you have to do it, as opposed to, well, if I'm going to get the bathroom redone, maybe I'll get a double wide shower, maybe I'll get like a really fancy thing, and I'm trading it off for something that I want, as opposed to being told that this is now something that I cannot have, which means I need to kind of deal with what that means for me.
Yes, yeah. So I suppose kind of thing that strikes me is that I kind of hear quite a lot of people say that through kind of DFG, I know there's kind of a different system in Scotland, but there's quite a lot of places, and it varies. I mean, these things always vary, but there are quite a lot of places that would do an adaptation as kind of cheaply as possible, and the aesthetics make absolutely no kind of don't score anywhere in terms of the thought of what's provided. Do you think there's kind of a case to be made that by doing that, people are put off adaptations and kind of the preventative aspect of that is lost, and kind of people are
100%.
falling, and there's kind of hip replacements and whatever that could have been prevented by having a more kind of attractive or acceptable type of adaptation?
100%. I think one of the best examples for this is this movement around wet rooms and wet room bathrooms. If you go back sort of 10, 15 years, we're looking at that, that glittery blue floor, that very institutional feeling. And then as they kind of gained recognition and they became more trendy, not only did the price come down because the materials were more commonly used and people knew how to install them, but people started, even within our data set, saying, I wasn't going to get a wet room, and then Brenda around the corner got one, and actually it was really nice, and I thought, well, I might as well have that. If I was going to have that, she's got a lovely little walk-in shower, and I thought that would go everywhere. But making these things so that they are very in keeping with the idea and the vision of the home that someone's been cultivating. Sometimes remembering some of these people have been housewives their whole life. This has been their whole job, to keep their house beautiful and welcoming and being able to bring people into it as a social space. Of course, they then want to continue that going forward, and asking people to accept what they think is going to be ugly or intrusive is a massive issue. It's the same thing that we get into around storage very often, because in some places storage is a luxury, and it can be. But if you are, for example, living with any issues of continence, suddenly storage is a necessity. I can't have people around to my house if all of my continence stuff is sat on the side in the bathroom, and my private business becomes public the minute they go to relieve themselves. It's exactly that kind of thing.
Yeah. Did you have any of the kind of participants had moved into a home that had already been adapted in some way? Because I think we can see that a lot, that when adaptations are done cheaply and there's a change of resident or tenant, that there's quite a high likelihood that it all gets ripped out, and it kind of turns kind of that cheap thing that's been kind of the perception that it was going to be cheap is twice as expensive, because it's ripped out 2 years, 3 years later and replaced with a bath sometimes, and then that's ripped out and the shower's put back in. So kind of doing it once and doing it well, I think there's a definite case to be made for that.
We 100% had people coming in and talking about, particularly, the white handle's got a huge amount of hate, in the study. That I think partly because they were so obtrusive, but also it's a real signal of vulnerability towards the neighborhood, and people felt very uncomfortable with that. So 100% where things were immediately obvious. And a lot of the things that we kind of trumpet and point out is that if they're integrated into the style that people have anyway, is you don't necessarily know why someone's gone for example, like a clear fronted cupboard, just that they have and it looks really pretty. You don't know why someone's chosen this or that. It's not trumpeting itself in that way. So people don't necessarily remove it. But 100% that kind of, I wouldn't go in, or I wouldn't have this, even where a lot of the kind of professionals we spoke to were like, no, we'd never, people have to go in, and we try and match adapted houses to people who need those adaptations as far as possible. There's always that tricky part. And it's particularly important if we're marrying up this idea of sustainability with aging sustainably, right? So increasingly we're aware that there's a carbon cost that comes with not just the manufacturing of the materials themselves, which if we're ripping out and putting in and ripping out and putting in, like obviously that's landfill, that's a huge issue. But there's a massive amount of carbon involved in putting feet on the ground to even install a thing. The more kind of construction materials you need, if you haven't thought about this kind of stuff ahead of time, all increasingly puts a load not on just on the people whose house it is who now need that adaptation, or the people installing it, but on the planet itself. It's a really important narrative to kind of link in with as we move forward.
Yeah. So as you mentioned, the project's now complete. Has it kind of given you ideas to do something else? Is kind of will it move on to a next stage, or what comes next?
We're really, really lucky. At the moment, we are in the process of working out what's called a demonstrator. So that is hopefully going to be something we can load onto literally the back of a lorry and tour around different places, initially in Scotland, which is particularly important because we've got some really rural communities, and assuming that everyone can trip down to Stirling in central Scotland to have a quick look around the dementia suites is not really feasible. Whereas if we put something on the back of the lorry and we take it up, suddenly more people might put eyes on it, start to understand that aging design does not necessarily have to be ugly design, and think about that for their own lives. We're also taking it forward in a project that's focusing on intergenerational relationships, because these kinds of houses and how we build houses for our communities in the future is going to be a massive part of how we age together as one community. Okay.
Has there been any kind of governmental interest in Scotland in kind of the research or kind of the ongoing and kind of the things you just mentioned about the kind of lorry and other aspects of that?
We've had some really good engagement so far. We had a lovely visit from the Housing and Planning Subcommittee, and we've had the opportunity to feed into some of the open calls around housing for varying needs in Scotland, and there was a Westminster call out around about the same time last year. But it's one of those things where building those connections and those relationships as we go forward is always going to be part of the process. Yeah. So if anyone from the government is listening, we'd love to come and talk to you for sure. But every little piece of awareness we can tick up is going to improve things overall. That's our hope.
Great. Well, thank you for joining us today, Kate. Again, it's really
so
interesting to hear for a second time, and yeah, I'm sure there'll be lots of interest in the truck as you get it developed.
Thank you so much.
Okay. Thank you.
Foundations Live.
Okay, thank you to Kate. I think yes, it's food for thought, isn't it, on the way we do adaptations, and it's interesting across the rest of the world. They don't use the word adaptations; they use modifications, which I think is kind of a much more kind of positive word. You can kind of modify a car to be a hot rod or whatever. You can modify your home to do things that are more positive. Whereas I think adaptations sometimes have more of a negative connotation. Before we move on to the second presentation of the day, I just wanted to let you know that nominations are now open for the National Healthy Housing Awards. It's being held again in Manchester this year. We've got a new venue at the Stoller Hall, which is a very nice kind of architecturally designed new venue just across the road from Victoria Station. We've had a great few days in Manchester over the last few years with the awards, and look forward to it again this year. So all the same categories as in previous years. You can be Home Improvement Agents of the Year, DFG Service of the Year, Caseworker of the Year, OT of the Year, Technical Officer of the Year, and a few others. So you find all the details on the website. There'll be a link in the chat if you want to nominate for the National Healthy Housing Awards. It's free to enter. I know a lot of awards aren't, and you get free tickets to come to the event as well. So it'd be great to recognise some of your work in December.
Foundations Live.
Right, our second doctor of the day. So welcome Rachel Russell, who's the Senior Regional Advisor at Foundations, and Rachel's going to go through some of the findings from the DFG Children Summit that we held a few weeks ago in Birmingham.
Yeah, it's a hard act to follow, and it's not often I get my Sunday name out. Yeah, just going to spend about 10 minutes just giving people a feel for what we covered in our second DFG Summit. So last year the summit was around assessment, and this year we had a summit again in Birmingham, and this year it was around children and DFG. So the Foundations team were joined by, I think we had around 190 odd practitioners, including occupational therapists, technical officers, case workers, managers that joined us in Birmingham for the summit. hopefully I can get my slide to move, just bear with me. So just in terms of why did we feel we needed to do a DFG summit for children, this is a real email that we received, and it's very typical of the emails that we get from, as regional advisors, from you guys out there doing the job. And I think what this email shows is just kind of the challenge that we face in terms of adaptations for children. It shows, obviously, we've got a child with really complex needs. We've got a child where we've already, or the practitioners, the OTs and the technical officers had already previously done something. Obviously, they were trying to involve the parents in the process and the assessment for the adaptations. Obviously, they as a team were really struggling to know what to do. Where's the evidence around what adaptations we should be providing? What solutions are out there? What adaptation solutions are out there? And also, I think really telling at the end of this email, which again we're hearing a lot as regional advisors, is, and I'm sure you are all experience, that you're getting more and more of these types of complex children's cases. So the summit was about bringing together the sector to look at some of those really thorny issues, I guess, that there are around DFG and DFG delivery for children. Now, the summit is very different to our roadshows, and it's very different to kind of a traditional conference that you might go to. So obviously a traditional conference, you're going to be kind of fed information, whereas for us a summit is that opportunity where we can bring everybody together that's got a collective interest in an issue and actually look at collaborating, looking at what the issues are, sharing potential ideas around actually how we could solve some of the issues that we have in terms of DFG and children's cases. And a summit, this is just a definition of a summit, which is about bringing together leaders, that collaboration to resolve those real world issues. So that's why we chose to do a summit. And as I say, it does have a very different feel to our road shows, and it is very different to a conference, because I guess you're coming to share your expertise when you come to the summit. So that's why we did a summit, because we need to bring you guys, the sector, together to look at actually what are the issues, what are you currently doing, what could be, if we do some blue sky thinking, what could be some of the solutions. The other thing that we always say at Foundations as well, and I know this might sound a little bit corny, but no matter what role you have in the DFG, whether you're a caseworker, whether you're the manager, whether you're a commissioner, we all have that potential for leadership and change. So doesn't matter who you are, we see you at Foundation as being those leaders for change. So just to give you, just go through the next few slides, just in terms of, so you can get a feel for what we did at the summit. Obviously, we had a warm welcome, and then we had plenary speakers. So we had Steve Ford, who is the CEO of the Royal College, and he just kind of gave an overview around some of the workforce challenges that there are for occupational therapists, and kind of related that to the work around children's. We then had Luke Clement, who is a professor of law at Leeds University, has done lots of work with Cerebra, which is a charity that supports children with disabilities, and he's done lots of work. So if you Google Luke Clement, Cerebra and adaptations, that should bring up a few of the reports that Luke has done with the students at Leeds University. What Luke was able to do was talk about the challenges but opportunities that there are in terms of the statutory duties that housing has in terms of the Housing Grants Construction Regeneration Act, what statutory duty that social care has in terms of the Children's Act and the Chronically Sick and Disabled Persons Act that still applies to children, and kind of looking at, actually, if we look at children's adaptations in terms of what will the system benefit in terms of if we all work together, And as I say, Luke's presentation was able to kind of bring that to the audience. Just to let you know that all the presentations for the plenary session are available on our foundation's website. So if you do want to take a closer look at the slides that Luke presented and the challenges and opportunities around looking at this from a systems perspective, they are there. And then we had an absolutely fantastic presentation by Mark and Rhiannon. So they were bringing that lived experience. So actually, Mark is an occupational therapist. His daughter, Rhiannon, is autistic. But what they were able to do was deliver a very pragmatic and I think level-headed presentation around the benefits of having a DFG and what their family has achieved and the outcomes, the adaptations have achieved for Mark and his family, in particular Rhiannon. So he's able to bring that, but also just he uses humour really well in terms of actually some of the challenges that they had as a family. And actually, I think sometimes as an occupational therapist, I think, we work 9 till 5. I know we often work longer hours than that, but I think sometimes, we don't live it 24/7. And, I think what Mark was able to bring alive along with Rhiannon was that actually what it feels to live through the DFG process 24/7. So that plenary session, those 3 speakers really set the scene in terms of actually some of the opportunities, but also some of the reality and challenges that we experience around DFG delivery for children. The meat of the day, I guess, were the 4 workshops. So we designed 4 workshops around the common issues that we get queries, emails, phone calls about at foundations, particularly us as the regional advisors. So we had 4 workshops, and those attending had opportunity to attend 2 of these workshops. So we had a workshop that was facilitated by Paul and Luke Clement, and that was looking at integrated funding for adaptation. So what are the challenges? What could we do differently? Paul had developed a kind of protocol, a matrix for the summit, and that's hopefully something that we're going to work on. But that was what that workshop was about. So looking at what the challenges around funding adaptations, because as we know with children cases, often sadly the issues don't fall neatly within the 12 purposes for which you can use a mandatory grant, and often the needs are wider than what we can do with the DFG, and how do you get everybody else. So that was what that workshop was about. We had a workshop around managing expectations. So how do we work really well with families? How do we make sure all the stakeholders work well together in the DFG? We then had the age-old issue around actually how do we make best use of the DFG and also ensure that we can kind of future-proof adaptations. And then the 4th workshop was around the opportunities, particularly with behaviours that challenge, and what are the opportunities and challenges of using technology and innovation for those children with complex needs. So there were 4 workshops. The objectives of those workshops was, in I must admit, a relatively short space of time, 45 minutes, having a really in-depth, intense conversation to look at what the issues are, what are the opportunities, and then to help the workshop facilitators identify things and actions that we can take at foundations to move some of these issues on, and to hopefully develop resources so that we can improve delivery of DFG. So what I'll do is I'll just go through the 4 workshops so that you can get a sense of what kind of were covered in the discussion. So here's Paul introducing his protocol, looking at the different strands of funding. The kind of key messages there was obviously increasing strain on DFG budgets. I think that's due to rising cost of materials, the number of referrals we're getting, the more complexity of cases that are being referred. There was obviously a recognition and an opportunity to improve cross collaboration across the sector. And again, the protocol that Paul developed enabled that conversation around, you know, was this tool a potential opportunity to collaborate? A recognition that perhaps sometimes social care, NHS does have a role. They do have statutory duties to meet needs, but actually the challenge then of actually trying to bring those stakeholders to the table sometimes can have its challenges. And then how do you then explore alternative sources of funding? So that was kind of the key highlights from that workshop. This is Adam from the OT service, and he facilitated a workshop with Chris, one of our, the consultancy manager at Foundations, looking at how we work with families, how, I don't like the word expectations because I think people should have an expectation of what they can get from the DFG, but about how you make sure that people have got real good understanding around the DFG and what it can and can't necessarily do. So the key highlights from this workshop was that thing around, we recognise children have got specific needs, but how do you balance that with trying to find something that's cost effective, that also kind of fits within the necessary and appropriate, reasonable, practicable when we're thinking about eligibility in DFG. That importance of really involving children and families in adaptations. I think sometimes we want to protect families and therefore we don't get them involved. But I think Mark and Rhiannon's presentation really demonstrated that importance, no matter how difficult it is, that importance of involving children and families within that, within that process. Interesting point around the role of occupational therapists in the DFG process. Often there can be multiple occupational therapists that can be involved in children's cases just due to the nature of those cases. Just differing views on what the role of the OT is. And then one of the things that came up, which is quite interesting because it's something that we've just looked at in the new DFG approach to the new approach to the DFG for behaviours of concern, is making it easier for the family and, you know, really trying to streamline it and avoid parents having to get multiple bits of evidence to justify why they need the adaptation. So key highlights from the third workshop was just, so this was about future-proofing. So just, there is constantly in the world of construction, there is always innovative design methods coming into play. And it's about how we keep on top of those innovative construction methods so that we can use those to make best use of available space, etc. Again, seems to be a message from Kate's presentation that, you know, that real importance of prevention. Although one of the issues with the DFG, if you look at who's eligible for a DFG, you have to have substantial impairment, which kind of doesn't really support that preventative approach. But the importance in terms of future-proofing, in terms of preventative strategies, because actually if you get preventative strategies in place, sometimes it stops you needing a more expensive adaptation. Common problem, those challenges of working with children with really diverse needs, and sometimes where you perhaps get two siblings with needs, often they can have quite diverse needs as well. And again, kind of linking into that first workshop that Paul hosted with Luke, that need to, you know, join up the system. So how we work better with health and education colleagues to deliver the DFG and how we work collaboratively to achieve that. One of the things that Rachel Frondingham and Claire Miller introduced was the idea of using the PEOP model. And again, you can have a look at their slides, so you can have a look at how they use that model just to shape that conversation in terms of designing something that is future-proofed. And then finally, we had Ruth and Alan, who delivered a workshop around technology and assistive technology and innovation. I'll put the wrong title on here, but it should be technology and innovation. Particularly around using that in terms of looking at a less restrictive approach for children and all that, those bits around complex needs and deprivation of liberty. So the key highlights there was around, exploring actually what assistive technology is out there. I think there was lots of conversations around the balancing the benefits of assistive technology with that concern around, is it a restrictive practice or not? And again, similar to the previous couple of workshops, that importance, that kind of, and it's a theme through all of them, that importance of involving children and parents in the process, and particularly, the choice of an assessment, so that we get the right choice of innovation or technology, assistive technology. And also a key thing that was mentioned here was that need for regular review with technology, and so that changes in the technology can may be made as that child's needs change. So hopefully that just gives you a feel for some of the kind of key highlights that were discussed in the workshop. So just to summarise, we have written quite a comprehensive report, and hopefully Dan can post. I've written a blog, and we've written the report as well that just goes in a bit more detail to what I've discussed here this afternoon around what we found and what we plan to do going forward at Foundations, because we just don't want to have a talking shop. We actually do want to take away action that will hopefully improve and support what you're doing out there in the sector. So just some highlights. As I say, you can have a look in the main report. There's a table at the back of the report that goes into a bit more detail into what we are proposed action at Foundations. And also we've already got quite a lot of resources as well. So we've also signposted in that table to existing resources that will help you with some of the issues that we identified on the day. So this first one, we need your help with. What was really clear, and obviously one of the benefits of the summit is we heard lots of really positive stories, such as the story that Mike and Rhiannon spoke about in terms of their DFG, but there was also lots of other really positive stories around actually when we do collaborate, when we do involve health and education colleagues, if we do involve families, the brilliant outcomes that can be achieved. Now, we need your stories to help us demonstrate that and to share those stories across the sector, because what we know is that when one authority demonstrates that actually when we do this differently, other local authorities are more feel more comfortable about kind of changing practice and taking on board that good practice. So again, sorry Dan, probably giving you a bit of work this afternoon, but we have got on our website an area where you can submit your DFG stories. Doesn't have to be War and Peace. It can just be a really quick story about something that you've done that's demonstrated good practice in the delivery of DFG for children. And if we can collect those stories from you, it means that we can promote that good practice and demonstrate that these things can be done. So obviously we'll be championing that. We will look at developing, one of the things was around that return of investment. So, if we look at systems approach to outcomes of DFG, so if we do an adaptation, it means we stop X amount in care costs. So hopefully we'll be working on a tool or a guide that will help demonstrate that return of investment. There are also, we've already got an evidence base on our website that also covers some other existing reports and research papers that demonstrate that as well, but hopefully we'll get something a bit more specific around children. And again, the Cerebra report that is also on our website is another good tool that you can use at the moment. We're already working with Alan, developing a guide in terms of the DFG and assistive technology. So hopefully we'll be publishing that. And also Mark Pearce, who's one of our regional advisors for the East of England and East Midlands, is doing a fantastic piece of work. Again, collecting what you're doing out there to develop around a searchable database, so that you'll put in the issue that you're having or a solution that you want to look, and then it'll come up with some solutions. And again, you can find more about that on our website. We'll do one of the things that came up was around looking at training needs around helping upskill ourselves around children. So we'll be working with you to get a better understanding of what gaps there are in training and how we might be able to support that at Foundations. One of the things that we constantly do is advise government. That's one of our roles on behalf of the department, is advise government in terms of the real world issues that you're having and what would good look like. So we'll continually advise, because it was something that was brought up at the summit, is around the limitations of the current upper limit in terms of the mandatory. So that is something that we'll continue to advise government on, around the challenges that has on you guys doing job out there. Obviously, again, in terms of the role that we have with the department is obviously, and again, if we can get your stories, it really helps us to inform who we work with at the department to really show the benefits of doing that preventative approach. So again, can't stress strongly enough the need for those stories. So please, please think about submitting one. Again, we are working with Invisible Creation around the Fit for Our Future campaign, because one of the things, again, that was mentioned during the summit was that need to work even better with housing associations. So I haven't got time this afternoon to talk about the Fit for Our Future campaign. Again, hopefully Dan might be able to, or somebody might be able to just to put a link so you can explore what that campaign is again. But there again, I think that's an opportunity for us to use that campaign to kind of promote the fantastic work that we can do with housing associations, particularly addressing children's needs around adaptations. Again, one of the things that was mentioned was that we're already doing is housing assistance policy, and how you can use your housing assistance policy to deal with these more complex cases. So this is already available to you. So if anybody out there is wanting to look at how we can better use our housing assistance policy to deliver DFG even better to children, please contact us, because we can look at working with you on that. And as I said, we're just going to do a little bit of extra work on the funding protocol that Paul developed for the workshop, and hopefully we're going to try to get a little bit more feedback and look at publishing that as well. As I say, in the main report, there's a lot more information on there in terms of other bits and pieces, very simple things that we can do that will hopefully improve what you do, make life easy for you, what you do out there in delivering DFG. So please have a look at the report. And as I say, if there's anything ongoing that you need support with, remember, we've got the 5 regional advisors. We're here to support you. So please get in touch if there's anything that you want us to follow through with. So just really quickly, I think this photograph of Mike and Rhiannon kind of sums it up, because actually when we get DFG delivery right, this is what we see. We see a young person that, you know, was able to participate in a conference or the summit, and this is why we do the DFG. And those are just some kind of conclusions. So just the opportunities that we've got through the summit and ongoing work. And that's it. And there's a link there to the report.
Great, thank you, Rachel. That was a good day, wasn't it? Good day. We had a good day in Birmingham, and I think as you say, kind of having Mike and Rhiannon there really set the scene for the day in terms of some of the issues they faced and some of the benefits they've had from going through the process. And I think kind of my takeaway from the day was that these kind of big and complex cases, even referring to them as a DFG probably isn't particularly helpful, because they're not actually DFG. Kind of DFG goes up to 30,000. If you're talking about something that's 200,000, then I do my maths right, DFG is only 15%. So it's
Yeah.
I think of them as DFG, I don't think is particularly helpful. So that's, I think, something we'll be working on is looking at different ways to approach these more kind of complex cases that don't assume that they are DFGs. Because I guess kind of back in 1990s, 2000s, there weren't that many cases that were much more than the upper limit. But now that there are, it's very different, and taking the same approach clearly isn't working.
I thought Luke made a really good point in his presentation. I think what we forget is that social care has always had a responsibility for adaptations well before we had the Housing Grants Construction Regeneration Act, because obviously in the Chronically Sick and Disabled Persons Act, which was 1976, is it? 1971. Oh, even older than I am. It's in there in terms of the duties that social care has in terms of provision of adaptations, and I think what we've forgotten with the DFG is that link with social care, particularly for children's. Yeah.
Oh, it's 1970. I'm not as close.
Yeah.
But yes. So I think more work, and I suppose the other thing that did come out was that a looked after child in residential care can cost £280,000 a year. And kind of social care sometimes spend like that, whereas spending £200,000 on adaptation can take years to agree, and kind of during that period of time, that could have been spent 2 or 3 times in terms of social care costs. So it's kind of a different way of thinking. I think hopefully a big thing that comes from the summit. But it was a good day. It's a good day, and we're thinking about what we might do for a future summit. So if anybody has any suggestions on big and thorny issues around home adaptations or perhaps home modifications or home improvements, then please get in touch. We'd love to hear from you. But thank you, Rachel, for that whiz through what we discussed on the day. Thank you.
Foundations Live.
So that's just about it for today. Thank you for joining us. I think it's been a really interesting afternoon again. So just a reminder on some of the bits and pieces coming up that I'm sure you won't want to miss. As I said at the start, the DFG Champions Roadshows are returning in the autumn, visiting Liverpool, Sheffield, Wolverhampton, London, Colchester and Southampton. So if you want to book a ticket for those, they're going quickly. Be good to see you there. And the nominations for the National Healthy Housing Awards are also open now for the event in the awards ceremony in December. In September, the team's also on the road with a number of bathroom manufacturers for the bathroom adaptations technical training tour. So we'll be around the country for that. If you're a technical officer and want some CPD on how to install a bathroom, you'll find all the details on the website. We also have an ongoing range of network meetings. So we have network meetings for different regions across the country. We also have some for specific job roles. So we have network meetings for OTs, caseworkers and technical officers. And we also have a community of practice network meeting for behaviours of concern. So they're ongoing through the year, and we've recently set up a new online community for those groups so that you can continue the conversations outside of those meetings and get all the updates. So if you want to join Foundations networks, again, you can find the link on our website. It'd be good to see you. Good to see you there for those. In terms of Foundations Live, as usual, we're going to take August off, mostly because I'm going to Australia next week, so I'll be away for most of August. But Foundations Live will return in September, and we're going to have sessions on sustainability, as mentioned earlier. So I'll be talking about sustainability in delivery of home adaptations and some of the manufacturers and suppliers and how they have introduced particular sustainability and net zero targets across their supply chains. We'll also have a session on kind of health and safety and technical issues around CDM and asbestos. which I think kind of applies to everybody involved with adaptations. And if you're an OT and don't know what CDM stands for and your role as a designer, then definitely recommend that you come to that session. And third one we've got planned is around smart home automations and adaptations, and kind of the smart and fancy bits of kit that you can do to automate jobs and functions around a home. So we'll have new guidance, and we'll have whole foundations live dedicated to that in the autumn. But that's all that's coming up. Just leaves me to say thank you to Kate and Rachel for their presentation, very interesting presentations today. If you want to catch up on them, you can either catch up on this on demand on social media or on our website, or there will be clips on our YouTube channel either later in the week or next week. If you want to give us feedback on today and get a CPD certificate, you can do that at foundations.uk.com/webinar feedback, and you get your CPD certificate by return if you leave your email address. So thank you all for today. Hope the sunshine's come out where you are. I think it might finally have come out here, and maybe we'll get a bit of sun and a bit of summer back. But good to see you all again, and we'll be back with Foundations Live